Hi, I'm Professor Dr. Ashish Davalbhakta at Aesthetics Med Spa and Advanced Aesthetics in Pune. We are covering a series of educational lectures on chemical peels, and today I'm going to be talking about the common myths or misconceptions about chemical peel. Chemical peel, as we have covered earlier, is made of fruit acids, and when you apply it on the skin, it helps in shedding of the epidermal cells and helps the dead skin cells to shed off and allows growth of new healthy cells to come up. It's a very common and popular procedure, but there are a lot of misunderstandings. One of the commonest misunderstanding is that if you're having a chemical peel, it will make your skin peel a lot and it will kind of peel in layers. So this is a myth. There are various types of peels and they work differently, but the common peels like glycolic or salicylic or mandelic or others, they do not cause peeling in layers. The peeling may be even invisible to microflaking. Again, depends on the depth of penetration that your professional physician or doctor wants. TCA peel is a peel which may cause a layer to come off, but most of the other peels, they don't cause visible peeling. They are usually invisible or microscopic shedding of the skin cells or flaking, which when you wash, it disappears. If you apply moisturizer, it disappears. Although it is beneficial to have a flaking or peeling, it's not always something that can happen. Another myth associated with peels is that every time you have a peel, you have the same effect. Again, that may or may not happen. You may have aggressive peeling in one peel and then barely minimum peeling in the second or subsequent peels, or vice versa. Another myth is that if I go to a clinic for a consultation, they can do a peel right away and you can start off with your peeling sessions right at the first consultation. So it's usually advised to have some conditioning of the skin by using skin conditioners like moisturizers or mild glycolic acids or some skin lighteners like arbutin or kojic acid as a skin conditioning program in the form of creams that you apply for at least 10 to 15 days to ensure that the skin behaves in an appropriate manner when the peeling is done. What I mean by that is that the penetrance of the peel is then more uniform and you get a uniform and a much controlled outcome if you have conditioned the skin prior to having a chemical peel. If you go in and straight have a peel, you are at risk of very rapid penetration at various spots, not even uniformly. So you get aggressive penetration and peeling in one area, which is then prone to PIH, while the other areas have not penetrated enough. So prior skin conditioning is important. So that is something that is important when it comes to chemical peels. Another myth is that if you're having chemical peel, it's okay to be out in the sun or be active or have your sport and not worry about the effects. What happens is in a chemical peel, we are breaking down the keratinocyte layer, the epidermal barrier, and as the shedding is happening, our natural skin protection is depleted. And then it becomes very susceptible, such as excessive UV rays or sun causing pigmentation or excessive drying causing dull appearance of the skin and darkening. So you must use a sunscreen and the recommended post-peel creams like moisturizers and other things to and protect from direct sunlight, like use a cap or an umbrella or stay in the shade so that you are not affected. Another common myth when it comes to chemical peel is that one chemical peel and that's it. I just need one chemical peel. As you understand the process, it is microscopic shedding of the cells and we are working on evening out the layers, the newly formed skin cells. We want them to be nice and compact and uniform, and that's why one needs to do sessions. And sometimes your physician might recommend 4 sessions or up to 6 sessions of chemical peels, and done every fortnight or maybe every 3 weekly to get an optimum outcome. And you don't get to see the result till you have done 3 to 4 peels. So it is something that one has to put up with, and you don't get to see the result right from the first peel onwards. Another myth is that there's one peel for everything, just one type, but that's not true, because there are so many different types of peels, and every peel has a different kind of a physiological effect. So there are salicylic acid peels which work on reducing the inflammation and which is mostly used in acne prone skin, while there are glycolic acid peels which help in reducing the rough epikeratocytes and making the skin look brighter and fresher. Or there are lactic acid peels which help in improving the hydration of the skin. There are many peels like this, and every peel has a different benefit. So your physician would be able to recommend a particular peel looking at the indication or reason why you're having a peel. So these are some of the myths and misconceptions that one has about chemical peels, and I think this should be enough for today's educational video. So if you have liked the video, please click on the like button and subscribe. Thank you very much.